So aquablation is a new treatment for men who have voiding symptoms due to BPH. The two things that make it unique are the use of ultrasound to create the surgical map. In all other treatments for BPH, the only thing that's used is visualization by the surgeon. This uses ultrasound so that the entire prostate can be seen. The surgical plan can be created using the ultrasound to make sure that we're removing prostate tissue that we want to remove, sparing areas that we don't want to remove, to create an efficacious treatment with low risk of complications. The second thing that makes it unique is that the resection method is heat-free water jets. So there's no heat effect which can potentially injure structures that you don't want to have injured. So those are the two things that make it unique. So patients in the operating room get an anesthetic. We then place an ultrasound probe to image the prostate. With that ultrasound probe in place, we can see the entire prostate, the bladder, and other structures, so that we can then use that ultrasound image to create a surgical plan. That surgical plan is then implemented with an instrument that's placed in the urethra that uses the heat-free water jets to remove the prostate tissue according to the plan, very precisely, rapidly, and it takes about 10 minutes for the water jets to work. After that, a standard scope is inserted into the urethra after the treatment device is removed to look around, evacuate any kind of tissue or blood clots that are in there, and to do final cauterization of the remaining tissue before a Foley catheter is placed. So the great thing about this treatment has been around for about 10 years. The long-term risks are very low, so that the risk of poor urine control afterwards in all the studies that have been done is less than 1 out of 100. In men who are sexually active, the risk of changes to their erections is essentially 0. The risk of loss of ejaculation is less than 10%. So it's really effective as far as that goes. As far as results of improvement in urination, it's at least as good as any of the other treatments that we have. So patients normally see a fairly quickly profound improvement in the way they urinate, less obstructive urinary symptoms, less irritative urinary symptoms. Now, after the procedure, folks should expect to stay overnight. Most folks will go home with a Foley catheter for up to a week. When we remove their catheter for several weeks, they can have some burning with urination that usually gradually improves, but they see improved voiding symptoms within the first week to weeks after the procedure is done. The other thing that makes this extraordinary is that the durability of it is better than any of the other treatments that are out there. So that in the largest study that's been done, only 2.5% of men had to have a second procedure done at the 5-year mark, which is really remarkable compared to a lot of the other treatments that we have available. We'd be glad to see anybody who thinks that this would be a good procedure for them at our office. I'm David Cook. I'm a urologist here at Caldwell UNC, UNC Surgical Specialist Urology, and look forward to seeing anybody who thinks they're interested in this procedure or for any other urology needs.